Hi, guys. Welcome back for our daily practice questions. It is day 119, and as always, I like to first start with my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states, a nurse practitioner honors a competent patient's decision to refuse a life saving treatment. This action reflects which ethical principle? Is it A, beneficence? Is it B, non maleficence? Is it C, autonomy? Or is it D, justice? Take a moment and tell me what you got, you guys. All right, so y'all know I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So here, the stem of the question states, this action reflects which ethical principle? All right, so let's see what we're talking about. So, a nurse practitioner is honoring a competent patient's decision to refuse a life saving treatment. Y'all, this is C, autonomy. Remember, I tell y'all with ethical terms and non clinical terms, make sure you know these definitions. So, in scenario basis like these, this is only simply going by a definition, right? So, allowing someone who is competent to make that decision either to refuse or to accept the life saving treatment is autonomy. That right of free will, the independence, right, is autonomy. So C is your best answer. Question number two. A nurse practitioner carefully considers the risk of side effects before prescribing a new medication to ensure no harm is done. This best represents which ethical principle? Is it A, fidelity, B, beneficence, C, non maleficence, or D, veracity? Take a moment and tell me what you got, y'all. All right, so stem of the question here states, this best represents which ethical principle? All right, so let's see what we're talking about. So, a nurse practitioner carefully considers the risk of side effects before prescribing a new medication to ensure no harm is done. Y'all, C is your best answer. Non maleficence. Remember, non maleficence means to do no harm. I say think of it as no malice, right? Doing no harm. This is specifically stating that the nurse practitioner was considering all of the risks and side effects before prescribing the medication to ensure no harm is done, to do no harm, okay? Pay close attention to these phrases and really deciphering these, as beneficence and non-maleficence can kind of teeter closely together, as beneficence is to do good, to benefit them, right? Whereas non-maleficence is to do no harm. So I say, if you get in a scenario and you're trying to figure out one versus the other, I say approach it like this. Is this specifically done to do a good deed? You're going above and beyond just to do something good. Or are you doing this specifically to remove any harm? Okay? So like in this scenario, it tells you to ensure no harm is done. So to do no harm, okay? Question number three. A nurse practitioner ensures that all patients, regardless of insurance status, receive the same level of care. This is an example of A, veracity, B, justice, C, fidelity, or D, confidentiality. Take a moment and tell me what you got. All right, so stem of the question is, this is an example of, so we have a nurse practitioner who ensures that all patients, regardless of insurance status, receive the same level of care. And the best answer here is B, justice. Justice is fair, fairness, treated equally. Um, and if you struggled with this, go through your terms. Veracity means truthfulness, right? Truth, right? B, justice, fairness. Fidelity, is like loyalty, faithfulness. And then confidentiality, keeping things confidential, private. And then let's go back and look at these other ones to make sure you know your terms. Again, fidelity is that faithfulness, that loyalty. Beneficence, to do good. Non maleficence, to do no harm. Veracity is truthfulness. And then in question one, same thing. Beneficence, non-maleficence, autonomy is the act of that free will, the independence, and justice, equal treatment, fairness. Okay. So make sure y'all know those terms so that if you are encountering scenarios that you're able to get these answers correctly. These should be easy points for you, right? So just make sure. I tell everybody, I know y'all get so tense about non-clinical material, but if you know what to study, you'll be good, right? There's less variables with non-clinical because it's straightforward terminology. So just reviewing the appropriate terms and what falls under the non-clinical content will get you success each time, y'all. Repetition is the key to retention. I always tell you that. But as always, y'all, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any other resources that I do offer, feel free to reach out to the Nursing Studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one at gmail.com. Everything that I offer is linked in the bio of this channel. And if you are looking to book any of my one-on-one sessions, any of my custom packages or plans, any of my question analysis sessions, I always say either call, text, or email, as I prefer to speak with you first so that I can gauge what you truly need to make sure you're booking the appropriate session type. All right, y'all. Y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.